Well, this is our COVID section of the wheel this week. Manufacturing consent, because every week they bring out a new line that they're gonna wave. Oh my God, my map disappeared. Ah, look at that. We went in and out of the studio so much all day. My
map?
COVID map. Well, that's different. I mean, that's the map
Oh,
of kids in the country. But yeah, I don't know where my thing went. All right. I mean, this is just horrible, but as of October 22nd, 96% of children had been infected by SARS-2. When Biden took office, this number was roughly 20%. In less than 2 years, the administration and CDC will have managed to implement a pandemic policy that resulted in nearly 80% of children infected with SARS. This is, somebody said, oh, our insurance company is going to save the day, which, haha, no, definitely not. But because they are number crunchers, and because their bottom line is, making money and denying people who would cost them money, insurance people are saying mild Omicron is causing the highest death rates amongst working age people ever seen in the history of insurance. So there goes that whole mild, line that was started. I don't know if that was, what was that, Monica Gupta or whoever it was, but I mean, there was a whole list of people over 2021, ever since Biden got into office, 2021, 2022, who just started, talking about, well, now that we have the vaccines, you can rip that mask off. And that was, again, that was Biden working with Republicans and the Koch brothers to take away any stigma. We had Rochelle Walensky calling the mask the scarlet letter, in spite of the fact, and this is how the tail was wagging the dog, a majority of the country in every state was in favor of mask mandates when there were spikes in COVID. And so how did they deal with that? They changed the transmission map from, hospital intake to hospital intake from COVID community transmission, right, because that would precipitate mask mandates across the country even now. And my map is gone, but it still is a bright red map on the old map, but pastel green on the new one.
If people realized there was a threat to COVID in their community, they would mask. They would support mask mandates even.
Yeah. Yep.
But and that's how ignorant by design the public has become regarding COVID.
Right.
So I want to just call out all the leftists again who are not covering this.
Yep.
What the fuck are you doing? You are playing into the Koch brothers' hands.
You really are. And, you look at, again, like, what are the wealthiest people in the world doing? Well, they're at Davos now, and they have the World Economic Forum is forcing everybody, including journalists and participants, to take a PCR test upon arrival. If you don't take a test, the chip in your ID badge is deactivated. And if you test positive, the badge is also deactivated. Here's a great account, Turn, who writes about, all things COVID. And he says, what do you see in this picture? This is at Davos, the billionaires. You see a filter down on the bottom left, and you also see the person wearing a parka indoors. And so from that, he infers that windows are open. So they are cleaning the air and they are ventilating because they know COVID's not over. They're taking a PCR test. And I mean, they're not wearing masks, which is I think a crazy risk, but they're cleaning the air. They are ventilating. They're doing PCR tests. So they do not think this is over in any way.
But they still want to present the image that it's over.
Well, you got to get everybody back to work.
Yeah, you got to work because it's the economic forum. That's the whole deal.
Yeah.
But let's talk about the pieces of shit in our government who have promoted a lot of this nonsense. Starting with my favorites.
Yeah. Surgeon General Vivek Murthy, who I don't know if you've noticed, but recently he's all about vibes. He's like, I've seen a couple of his tweets and it's just like, what's the most special thing you did over the holiday or whatever? Like,
show me your cat.
You're the Surgeon General. But he's been leading periodic off-the-record discussions that include a few dozen physicians, academics, and other well-known COVID-19 commentators with large Twitter followings, like Baltimore's former health commissioner and CNN analyst Leanna Wen, Baylor University virologist Peter Hotez, and New York University epidemiologist Celine Gounder, according to several people familiar with the call. So they are given instructions of what to put out there on Twitter.
Yeah, it's just like when all the social media people on the remember that picture at the White House with all the leftists meeting with Biden, or the
leftists, liberals getting their talking points. It was like the Brooklyn Dad person.
Yeah, Brooklyn Dad and all the
Mueller, she wrote. Yeah, I mean, they were all paid propagandists. So yeah, go ahead.
Well, but so this was following up. We're missing the
I know something happened. StreamYard, what are you doing to us? A couple of our graphics are missing. So basically what they're saying is, they're told what to do.
Story, I'm sorry,
no, go ahead.
So this story in the Washington Post is where Liana Wen presents this argument that well, and this is the interesting thing, is the article doesn't even have her saying that deaths are overcounted. It's just a headline. What she is admitting to in the article is that hospitals are over-reporting COVID cases because someone comes in with a broken leg and they have a COVID case. But she makes nowhere in the article at all is there anything about overcounting deaths. It's a total
manufactured headline.
It's completely nonsense.
And then you get the anti-vaxxers who are like, well, look at that. See, we were right all along. The truth is finally coming out.
Right. But because of this headline alone, which is supported by all the terrible people who are pushing the anti-COVID minimization stuff, like Liana Wen, it gets played out and spread to people, and they use this article as an excuse to say, well, the public doesn't want it. Look, there's that article out there. And, people on the left.
Well, and also, again, like, you can only, you can only keep denying the reality so long. And when there are millions of deaths worldwide, but you keep wanting to insist that COVID is over, the way, like, what do you do? So now you say, oh, well, it's not deaths from COVID, it's deaths with COVID. It's like, what's the definition of is, right? And so they've made this, I mean, there was somebody else who also, like, people keep posting that article saying, you see, it's really just the flu. It's not such a big deal anymore. And that is once again how the liberals and the Republicans get together to manufacture consent and tell everybody that this is, to minimize this global pandemic that we are still very much suffering through.
That's the whole game. And it's Liana Wen is one of the worst of all these people. Because she lobbied all these personal stories about her decision to send her kids to school, and it was all based on, her kids at her school had air filtration systems and all this stuff. She doesn't release any of that information. She's just like, I'm
learning loss. They have to get back to school. Yeah.
And
meanwhile, they all got COVID, right?
And meanwhile, they all got COVID. But meanwhile, I mean, we know that, like, all those things, they were lies. Like, I mean, there is some learning loss, don't get me wrong, but they push this narrative about kids and suicide, and that pulls in heartstrings for parents. Oh my God, if I don't get my kid in school, he's going to kill himself. And suicides for kids actually went down when we were isolating at home. So that was nonsense. But it's that headline they get to spin over and over again. That headline is all, if you're not inquisitive, you're not even going to read the article, and you're not going to break down that even Liana Wen isn't saying all that shit that they put in the headline.
Yeah.
But it's enough that all these people they just repeat it over and over again. And it makes it up the food chain from either the Atlantic or the Washington Post or the New York Times. And then you get some other person that's already pushing the same narrative to just casually bring that up on MSNBC because he's a pundit on MSNBC, because he's going to push the same thing, and he's going to refer to this article that he read, and that this is how the public thinks on this now.
It's really, it's pretty bleak because there is no plan, and there could be a plan, right? Like, cleaning the air is the way to get out of this. It's not vaccinating. I mean, yes, vaccinating, masking, isolating, testing, quarantine, all of that, super important. But to actually end the pandemic, we do all of those things to flatten the curve while we filter the air, clean the air. Are you leaving?
I'm getting a beer. This is important stuff. This is important.
Okay. I was like, wait, it's 6:30. He's out, hard out, done. I know we have to go anyway, but they're not going to talk about that. They're not going to invest in that. I mean, we're 3 years in now. We could have actually really had an enormous overhaul of our infrastructure.
And the truly undebatable science, if you talk to scientists, is that masks fucking help, cleaning the air fucking works. Those two things, no matter what you say, yeah, maybe they don't get us out of the pandemic, but they slow the spread of this. And if you slow the spread of this, vaccines have a chance to actually stop the spread themselves. But we're so far behind because we're always chasing, because there are new mutations all the time, because nobody's taking any precautions, and we have this mutation fucking factory.
Yeah, that's what we are right now. We are gerbils in a mutation experiment right now.
Just slow it down a little bit, and maybe we have something that'll help. Maybe the treatments won't be, maybe monoclonal
right now they're not even
antibodies
effective.
Will work. And half these treatments that people are told work. Sorry, YouTube censors. If you're listening, half is it's not actually half. I don't know the number. Whatever you're going to use to kick us off of Twitter or YouTube,
but basically,
but a lot of these precautions a lot of these treatments aren't working as
they're not working on these new variants, right?
And that's not being told to the public. They're not coming out and saying, well, sorry for kids.
Use the tools. Do your own research and use your tools.
Yeah. Sorry, Paxlovid doesn't work for some of you. Sorry, you can't get some of these antibodies.
Treatments. You can't. A lot of people can't even get them when they, you can't even get the tools that they tell you are available to you.